Let's do a quick review on insulin. There are 4 types of insulin. We have rapid, short, intermediate, and long. First off, let's look at rapid. Here are some common generic and trade names you'll see associated with rapid-acting insulins. Something to know about rapid-acting insulin is that they have the highest risk for hypoglycemia. So your patient must eat a meal within 15 minutes of administration to prevent that hypoglycemia. Then we have short-acting. You can easily recognize these by the R's. We have regular, Humulin R, and Novolin R. So remember the R's. Something to note about short-acting or regular insulin is that it's the only insulin that can be given IV. Then we have intermediate. You can easily recognize these by the N's. So we have NPH, Humulin N, and Novolin N. So intermediate, think the N's. Intermediate insulins are typically prescribed as a standing order, like twice per day or BID. Lastly, we have long-acting insulin. Long-acting insulin, we have our L's. Some common ones are Lantus and Levemir. So remember the L's of long-acting insulin, but not Lispro, that's a rapid-acting. Something to know about long-acting is you never want to mix long-acting insulins with other insulins. You can remember this by the memory trick, long-acting, think lonely. Don't mix it with anything else. That's all for a quick review on insulin. You can find more pharmacology help like this in the pharmacology flashcards. You can find these cards on my shop, Nurse in the Making. Happy studying, future nurses.